Hello dear viewers, and welcome to our channel. Today, we'll be talking in detail about everything new parents need to do once they bring their newborn baby home after birth. Bringing a baby home is one of the most joyful yet overwhelming experiences a parent can have. You're no longer in the hospital. The medical team isn't by your side anymore, and now this tiny human is entirely in your care. But don't worry. Armed with the right knowledge and awareness, you can handle this process in a healthy, calm, and confident way. The first priority is to make sure your home environment is ready for the baby. The American Academy of Pediatrics recommends keeping the baby's room temperature between 72 to 75 degrees Fahrenheit, 22 to 24 degrees Celsius. Overheating increases the risk of sudden infant death syndrome, SIDS. The air should also be well balanced, not too dry, not too humid. A humidifier or dehumidifier can help maintain this balance. Ventilate the room regularly, but avoid exposing the baby to direct drafts. Your baby's sleep space should be simple and safe. Newborns typically sleep 16 to 18 hours a day, but their sleep is fragmented and often interrupted. The crib or bassinet should not contain pillows, stuffed animals, or thick blankets. Both the World Health Organization and pediatric associations recommend placing babies on their backs to sleep. Sleeping on the stomach increases the risk of suffocation. A firm mattress and a fitted sheet are all your baby needs for a safe sleep environment. In the first days at home, feeding is the baby's most basic need. Breastfeeding should be done on demand whenever the baby shows hunger cues. In the first week, it's normal to feed the baby 8 to 12 times a day. The WHO recommends exclusive breastfeeding for the first 6 months. During each session, the baby should be well positioned, with a deep latch covering most of the areola. Experts suggest rotating breasts between feeds and allowing the baby to completely empty one breast before switching to the other. This ensures the baby receives the fattier hind milk that's rich in calories. A well-fed baby will have at least 6 to 8 wet diapers and 2 to 3 bowel movements per day. Diaper hygiene is crucial, especially in these early weeks. Breastfed babies tend to have frequent stools, and their skin is extremely sensitive. Use lukewarm water and cotton pads to clean the diaper area with each change. Avoid alcohol-based wipes. Make sure to dry the area gently and apply a pediatrician-recommended diaper cream if needed. Avoid fastening the diaper too tightly to prevent chafing. Umbilical cord care is another area that requires attention. The stump usually falls off within 7 to 14 days. Until then, keep the area dry and uncovered. Diapers should be folded below the stump. Do not apply alcohol or any other solution unless instructed by your doctor. If you notice redness, foul smell, or discharge, consult your pediatrician immediately. Bathing can also raise questions for new parents. Until the cord falls off, it's better to sponge bathe the baby. Gently wipe the baby with a warm cloth, focusing on the neck, armpits, and diaper area. Once the stump falls off, babies can be bathed 2 to 3 times a week. Water temperature should be between 97 to 99 degrees Fahrenheit, 36 to 37 degrees Celsius, and baths should be short. After bathing, use a gentle moisturizer approved for newborns rather than scented oils. Newborns sleep a lot, but not in long stretches. They don't yet distinguish between day and night. To help your baby develop a healthy sleep rhythm, expose them to daylight and normal household sounds during the day. Keep nights dark, quiet, and calm. Over time, your baby will adapt to this routine. Feeding, diapering, and soothing cycles will eventually form a pattern. Crying is the most common behavior you'll deal with in the newborn stage. Babies can cry up to 2 to 3 hours a day during the first few weeks. Crying may signal hunger, a wet diaper, gas, overstimulation, tiredness, or simply the need for comfort. Holding your baby, making skin-to-skin contact, gentle rocking, soft singing, or white noise can help soothe them. Picking up your baby when they cry does not spoil them. It builds trust. If your baby is gassy, try gently massaging their belly in circular motions or moving their legs in a cycling motion. Always burp your baby after feeding. Your baby's first doctor visit should happen within the first week after coming home. The doctor will check weight, length, head circumference, jaundice levels, hip alignment, and reflexes. This visit is essential to ensure your baby's development is on track. It's also when you'll discuss the vaccination schedule. Come prepared with your questions. It's your chance to get professional guidance. Let's not forget about the mother's well-being. The postpartum period can be physically exhausting and emotionally overwhelming. Hormonal changes, sleep deprivation, and recovery from childbirth make it essential for mothers to rest, stay hydrated, and eat balanced meals. Family members should provide support and share responsibilities. If the mother experiences persistent sadness, crying spells, or feelings of worthlessness, it could be postpartum depression, and professional help should be sought without delay. Managing visitors is another important aspect. A newborn's immune system is still developing, so limit guests during the early weeks. Ask anyone who visits to wash their hands and avoid touching the baby's face. If someone has a cold or has recently been ill, it's best they postpone their visit. Finally, remember this: there is no such thing as a perfect parent, only a present, loving, and informed one. Every baby is different, and every family's journey is unique. It's okay to make mistakes. What matters most is that your baby feels loved, safe, and cared for. With time, you'll grow into your role and gain confidence. You and your baby are learning together. If you found this video helpful, don't forget to like and subscribe to our channel. See you in the next video. Stay healthy, stay loving,